What is the role of the Oncotype DX assay in patients who have a small amount of cancer in their lymph nodes? Ruth, how do we best talk about what are called micrometastases, a very small amount of cancer cells in lymph nodes, and how should those patients be treated? And what's the role of Oncotype DX in that setting?
So micrometastases are defined as a small deposit of cancer cells within the axillary lymph nodes, measuring between 0.2 to 2 millimeters of total cancer. And the reason that they're kind of designated like that is because there's some controversy about whether they behave like node-negative breast cancers or like node-positive breast cancers, although they are staged within the node-positive group. When it comes to how we manage these patients, in general, we tend not to think about them as having definitively node-positive disease. And the interesting thing about micromets is they really came to the fore when we started doing sentinel lymph nodes, because then we started really scrutinizing the lymph nodes and we were finding these very, very small deposits. So with regards to the 21 gene recurrence score and micrometastasis, when you look back at the B20 study that the initial analysis was done, there was very likely a significant number of patients in that trial that actually had micrometastasis. So the general thinking is that the 21 gene recurrence score should be perfectly reasonable to use in patients with micrometastasis, and those patients have been included in both the TAILORx study and the responder study. So if I had a patient with an ER-positive breast cancer and a micrometastasis, I would most certainly use the 21 gene recurrence score to make treatment decisions for that patient.
Yeah, and that gets to the issue of trying to avoid chemotherapy if we can. And there are plenty of patients who obviously don't want chemotherapy. It's one of the greatest fear your patients and my patients have. Do you want to comment about that?
Oh yes, I mean absolutely. If we can avoid chemotherapy in these patients, I mean it's so important to them. And I think by using the 21 gene score, we really have been able to avoid chemotherapy in patients where, 10 years ago, 15 years ago, we would have given them chemotherapy. So, I mean, if you do the math on this, we've probably avoided chemotherapy in 500,000 women since the test came out in 2005, 2004. So.
Thank you for your thoughts. Clearly, the Oncotype DX assay has an important role in patients who have a small amount of cancer cells in their lymph nodes.